Good morning and welcome to Joy in Our Town. I'm Crystal Rome, and you're probably wondering, why is she lifting weights right now? And why am I on a sports set? It's because today we're doing a health segment, and it's all about a fountain of youth. Yes, ladies, you heard me, a fountain of youth, and it's all natural. No painful plastic surgeries and no drugs. What am I talking about? Hormone therapy. I'm so excited to introduce our guest, Dr. Angela Miller, who's here today to talk to us about anti-aging. We also have two patients who are going to share their success stories with us. So I don't know about you, but I'm all in. So nice to have you here, Dr. Miller.
Thank you, Crystal.
Thank you. So why don't you start by telling us a little bit about your practice and about your approach to anti-aging.
Absolutely. Our practice is in Aliso Viejo. It's a private practice. We have one physician, Dr. Thermos, two physician assistants, Jessica Swerzak and Anna Torres. And what we like to do is have our patients come in, have a very candid conversation, and decide what their needs are. As far as the anti-aging approach, what we prefer to do is not use prescription drugs, but vitamins and supplements, depending on each person's needs.
That's great, yeah. And what is the difference in treating women versus men in aging? Is there a difference?
The interesting thing is there's only one molecule different between a woman's estrogen and a man's testosterone.
Ooh.
Right, just one molecule.
Yeah.
So what we do for both of our male and female patients is we check their hormone levels by blood. And for each sex, we replace the hormones that they need. But we all have the same hormones: estrogen, progesterone, testosterone, DHEA, men and women both. It's just in a different ratio.
Wow, and I've heard too that for women, if your testosterone is too high, that can be kind of dangerous too. There's certain things, if one is out of whack or higher or lower.
Oh, absolutely. It's just like taking vitamins. If you take too many, you'll get a toxic level. And most of our women come in because their testosterone is extremely, extremely low. And the only reason you would have too much testosterone usually is from a birth defect or a tumor somewhere. But what we do is we measure the levels and we give our women testosterone for their brain health, for their skin, for their mood, their motivation. And what that does is it enables us to fine-tune what each woman's needs are.
Wow, that's great. I'd like to come in. Sign me up for that. And how do you, the process of aging, does it affect everyone differently?
Yes, and that's a very good question, because some women, genetic is a big component, and they look like they're timeless, they never age. And other women, like we have the Lindsay Lohan, unfortunately, who has been aging rather quickly, smoking, drinking, sun damage. There's others that live on the East Coast in Florida, and they can retire and they look phenomenal. But it has to do with your adrenal glands from a hormonal standpoint, how much you exercise, how much stress you have in your life. So we actually try to touch on all those things, including your spiritual health. We will ask you about that, because we want a complete composite of the patient so that we can find out what it is that they really need.
Yeah, because I know in my life I tried to drink green smoothies and work out, drink lots of water, and do those certain things, but I mean, aging is inevitable. It's going to happen. And
well, there's some controversy about that too. You know, one of the things that we hear a lot about in the news is the human growth hormone.
Yes, I was wondering about that.
A lot of people love the human growth hormone. It's a celebrity treatment, most common in the stars that are super buff, and it seems like they never get old, except when you look around the facial features and they've had too much plastic surgery or lip injections. But the controversy surrounding the human growth hormone is the association between it and cancer. So that's more or less banned by the FDA. There's been articles in the newspapers about it, so we don't really go so much that route. But other natural hormones that are in your body, like pregnenolone and DHEA, that most people have never heard of.
Right, yeah, I haven't heard of one of those, yeah.
Right.
Wow, so so what are some of the common things with women besides PMS and, you know, certain things that everyone goes through, menopause? Are there certain things that aren't as obvious that women can look for?
Absolutely. A lot of women have come in with the diagnosis of dementia or Alzheimer's. We've had other people on medications or have been hospitalized for major depression with psychiatric disorders, many on sleep aids. So what happens is you have a composite of symptoms, and it seems that no one's making the identifying underlying factor that it's a hormone deficiency. And once you replace those hormones, it's like miraculously your joint pain goes away, your concentration, your focus is better, your mood is better. You don't have to have PMS. You know, having PMS is a sign that there is a hormone imbalance. Even in teenagers, they can have the disorder.
Wow, or some sort of deficiency that needs to be looked at.
Right,
So,
and corrected.
Right, right. Because I know a lot of times going into the doctor's office, you don't think about doing certain tests, like blood tests for certain things. Like
Right.
you do like the normal hormone test or whatever, but as far as some of them that you're listed, so that might be a good idea.
Right. What happens in general is everyone has an idea what their cholesterol is. They know if they're diabetic or not. They may have one thyroid test where we do a composite of 5 blood tests for thyroid, but almost 99.9% of the patients that see us have never had their hormone levels checked, not one single time. So they have no idea what they're deficient in, and they are prescribed prescription medications such as, well, we won't name the names, and it's not relevant, but synthetic hormones, and it's one of 3 doses, and that's all they get. So, and they've never had their levels checked, so how can anyone possibly know what they need?
Right, so it's a good thing we're doing this show to get this information out
To
there
get people informed that you have choices. You may not have dementia, you may not have Alzheimer's, you may not like your husband anymore. You know, there's things that can be done.
Yeah, okay. So bioidentical hormones versus synthetic. Now, I've heard a lot about this, that synthetic is bad.
Right.
And so what can you tell us about that?
The name synthetic implies, medically speaking, that it's something foreign going into your body. So if you eat plastic, your body doesn't know what plastic is, right? It wreaks havoc in different organs in your body, and your body wants to expel it. So you can't measure plastic in your bloodstream and know how much you need or how much is too little, too much.
Right.
Whereas on the other hand, bioidentical means that it's biochemically the same as what your body makes. It has the same function and the same structure if you look under the microscope. And because of that, you can measure it in a lab and you can fine-tune the dose or decrease the dose, what have you, based on that.
So what kind of hormones are offered?
The hormones that we offer vary from patient to patient. Some of my wonderful elderly women will come in and say they just want sex.
Oh, no.
It's just a sex. You know, they've grown old with their husband and they just have severe vaginal dryness. They've heard about the controversy, is it safe to use hormones or not? And they just say, you know, it's so painful and so uncomfortable. So what I'll do for them is not give them estrogen at all. I'll just give them a testosterone vaginal cream. Others need estrogen and the progesterone and testosterone. Most women, like myself, I'm 47. And I've been in menopause. Thank you. I've been in menopause over 5 years. I use the hormones. My mother uses the hormones. Other women with PMS typically just need progesterone. So, and our guys may need pregnenolone, the DHEA, and of course the testosterone. It just varies from person to person.
Okay. And the Women's Health Initiative, what is this? And I've heard a little bit of controversy around it, that it's affecting women and how they look at women. What is that all about?
You're bringing up a very good point, and that's where most of the concern lies. The Women's Health Initiative was sponsored by the National Institute of Health, and the study was brought about in 1996 or 97, and it was stopped early in 2002 because of increased risk of breast cancer and strokes, and well, the strokes came in 2004 and blood clots. But anyway, they stopped the study early because women were getting all these adverse effects. However, when they went back and looked at the data, after all these women stopped cold turkey, They got hot flash, they got night sweats, they can't sleep, they're out of their mind.
Yeah.
And doctors everywhere said, stop taking everything. And so women are going over the counter, getting soy, cohosh, what to do. They went back and they looked. The women who were getting an increased incidence of strokes, and it was only strokes, were women who were after the age of 60. There was no increased incidence of breast cancer, and in fact, the risk of heart disease actually went down if the women started the hormones, specifically estrogen, within 10 years of going into menopause. So there was more overall benefits, with the exception of strokes, and if you wait till you're 60 to 79, of course, you're going to have an increased risk of strokes.
Yeah, so there's more, the benefits outweigh the
Absolutely.
concerns, for sure.
Absolutely. And the quality of life. It's like, do any of us want to grow to be 82, 85, and we don't know where we are?
Oh, I know. That's the biggest fear, I think, for a lot
Our
of people.
Our bodies are hurting. Your quality of life is poor. You don't recognize your family, your kids.
Yes, yes.
Your skin is wrinkled. And all of us have some vanity, a few wrinkles. That's okay.
Yeah.
But to literally lose your mind, that's not quality of life.
Right. Right. And quality of life is what, God wants us to live. So,
Right.
Yes, we need to do all we can. So what other things, I know you have your patients here. I would like to hear some of their stories.
Oh, sure.
Of
Absolutely.
what they went through and what were your symptoms starting out. And
Mandy, you want to start?
That would be great. I'm 54, and I've been a patient of Dr. Miller's for 6 years. And when I first visited the office, I had increased weight, my symptoms.
Oh, tell them the list of the sheet of.
Well, and I had a sheet of 3 sheets of symptoms, and went through them with Dr. Miller in tears. And Dr. Miller said, "Well, I'm going to help you," and I was crying. Should I tell that part?
Yes.
And I said, "No, you're not." And she said, "Yes, I am. I'm going to make you feel better." And I said, "I don't believe you." Well, I've had numerous symptoms, such as increase of weight, extreme redness of the eyes, hair falling out, headaches, blurred vision, hot flashes, cold flashes, things like that, and it was unbearable. I mean, I was not feeling well. Anyway, when I started my hormone replacement therapy with Dr. Miller, every single symptom disappeared.
wow.
And I have felt great, and I'm so thankful to have Dr. Miller in my life.
Aw, you're a lifesaver.
Thank you.
Seriously.
You're
Thank
welcome.
you.
And
What about you?
Lynette?
Yes.
Yes, thank you. I have been a patient of Dr. Miller's for a few years now, 2 to 3 years, and I'm much older than the both of you. I will be 65 years old this year, and I know it's shocking even to me. I have to check
You
my
look
birth certificate
great,
all the time.
fabulous. So I'm sure everyone agrees that's watching.
But anyway, I had experienced a couple of things that you touched on, Dr. Miller, were my personal experiences with hormone replacement therapy prior to coming to you, and that was that I had tried hormones before with a regular doctor, as I call them, experienced the weight gain and just generally feeling puffy and not good, and went off them thinking, oh, forget hormone replacement therapy.
Right.
When I had the hormones with you, completely different. And I even remember saying to you, oh, but Dr. Miller, I don't want to take the hormones because I'll gain weight. And I always remember you saying, do you think that I would have a practice if all my patients gained weight? And I never gained a pound. And I cannot even tell you the difference in my life. In fact, I wished I had had these hormones many, many, many years earlier, because like I said, I am, midway into my 60s now. And another thing you hit on earlier was the aches. Like, if I had to say one thing that pops out immediately is generalized well-being, a feeling of feeling good. You can get up, you can move, you don't creak and hurt, and when you bend down, you just move like a more youthful person, and you don't have the aches and pains like you used to. And I can tell when my hormones are wearing off, when I need to, because I start to not feel good. But along with that, so many other things, my memory, my libido, my sex life is way improved. Everything is, and I tell everybody that I know about them and how they should really look into it because it makes a huge difference in the quality of your life.
Yeah,
So,
it sounds like
yeah.
it.
That's fantastic.
Yeah.
Thank
great.
you.
So
Yeah. So is there any other benefits you'd like to talk about?
Well, going back to aging, do we want to age gracefully? Do we want to age with aches and pains? Or do we want to do all that we can so that you're motivated? I'm not saying hormones are going to solve everything, but if you're motivated to get up in the morning, pick up your barbells,
Right.
do your weights, and I have my men, all of my men, no exceptions, 100 push-ups a day is the goal.
Wow.
And I have men
That's
from their
really good.
20s to their 70s, mid-70s that are doing 100 push-ups a day because they're motivated. They feel good. They feel like themselves. They're in charge. They're no longer depressed. They have a
Yes.
good relationship with their families, with their coworkers. You know how we always have that one coworker that's just ruins the day. And it just totally changes your sense of well-being. So once you start exercising, you want to eat better.
Right.
Once
right.
you eat better, you see the dynamics, one just leads to the other, that leads to the next. And by having the testosterone, the other added benefit is when you do exercise, you increase your lean muscle mass. So a lot of times you can work out at the gym and not see results, so you're discouraged. You're like, why am I doing this? And I'm not
Right.
seeing
There's
any
a lot
improvement.
of women that feel like that.
And men too,
Yeah, men
and they're just
too.
not toned, and they're doing everything they can. And as soon as we put them on the hormones, and we tweak the diet a little bit, most don't get enough protein.
Right.
You need protein
Right.
just like you need testosterone to build your muscle mass,
Yeah.
so that you see the overall benefits. So there's a lot to it.
Yeah, there
Yeah.
is. I know, and eating good and doing those things, like when you start to work out, you do start to feel better.
Right,
It's
and
like
you eat
everything
better.
in life feels better.
Right, it just makes sense, and that's an important point, is the diet. A lot of our animals are treated with hormones
Yes.
and pesticides and all sorts of chemicals, again, that are
Yes.
foreign to the body.
Yes.
So when you put something foreign in, it disrupts your metabolism. You not only not lose weight, but also you're ingesting more estrogen. So men who are like meat and potatoes kind of folks are eating artificial estrogen, so they're becoming more in touch with their feminine side. And that may not be what they're going for, but
Right.
it's absolutely what they're getting. When we check their blood, the guys, I'm like, hey, you have more estrogen than a woman that's in her 70s. You know, we got to make
Yeah.
some changes to correct that.
Yes, we do. I know in our household, we only have grass-fed meat if we do have meat.
Right.
And just lots of greens because that helps cleanse too. And
Right, and
detox.
there's more of a move toward a vegan diet. It's just like President Clinton, you know, God bless him, he brought to the forefront the importance of diet. It's always been around, and Dr. Ornish and other doctors, but they have proof that by eating a vegan diet, you can actually reverse heart damage, heart disease from plaque buildup. And again, this is increasing your longevity, because the number one killer for men
Right.
and women, number one is actually heart disease.
Yeah.
Most women are scared to death of breast cancer, but it's the heart disease that's going to, you know, most likely take your life.
that was the other thing I wanted to add, Dr. Miller, that you did that the other doctor that I had been to did not do, which made a lot of sense to me, was when I had requested hormones before, and I at that time was in my 50s, my mid to late 50s, just wrote me a prescription and gave them to me, and I remember thinking, well, how do you know how much I need? Oh, this will be fine. And my common sense told me, but I'm little and I'm not the same as the next person. How can you know?
Right.
And when I went to your office, the first thing that Jessica did was, before prescribing the hormones for me, was draw my blood to see where my levels were. And I said, thank you.
Yes, I mean,
So,
that's the most
because
important
how
thing.
are you
makes
going-
sense.
Yeah.
How are you going to know how much estrogen and progesterone or testosterone to give
Right.
me unless you know what my levels are now?
Yes.
And just everything is done the best way that it can be done for your body, not the general population, which you can't treat that way. So that was the other thing that is so outstanding about Dr. Miller's practice, is that it's very personalized to every individual, to them, and it's makes you feel the best that you can be. So
Wow.
that's
Yeah.
So it kind of enticed me when you said that depression, anxiety, all these different things that people can have.
Right.
If it could be just fixed with some hormones, like, you know,
Right.
a lot of people would
Truly.
be doing that, but they might not be aware.
And they probably would not be taking all the medications they're taking because they wouldn't need them.
Right.
I mean,
Right.
yeah, some of them.
With all the side effects that
Right.
go along with the antidepressants, such as weight gain and
Right.
vivid nightmares and libido, and your mood is so flat that your quality of life
Yeah.
is just diminished.
Sucked away, yeah.
And like you were saying, Dr. Miller, it all does work together because when you start feeling better, just from the hormone replacement therapy, then you start eating better, then your energy goes up, then you start exercising, drinking fluids, and becoming more aware of everything around you.
Or you go back to school.
That's right. So anyway,
Yeah.
that's kind of, it just all, you're right,
You're
it
motivated.
works together, yes.
So we've talked so much about women today. What can a man expect if he comes into your office for an appointment?
You know what, Lynette, didn't your husband?
Yes.
I don't think he'd mind if you share his story.
No, he is also a patient of Dr. Miller's and wasn't quite sure if he could be at first. And when he saw how great I was doing and how excited I was about everything, he asked me one day if Dr. Miller saw male patients. Of course, I said yes. But he also has the hormone pellets, if I may say so, which is the way we're receiving our hormone replacement therapy is via these pellets, which I had never heard of before. So,
Yeah, could you talk a little bit more about that, the way it's administrated?
Right.
Yeah.
So the hormones are given to each person depending on their customized dose,
Right.
either in a capsule,
Okay.
a lozenge under the tongue, or the cream is the most popular. It's something you just rub in. I show women twice a day or like so. Men, they can use the testosterone cream. It's much thicker, so they tend to rub it on their abdomen or inner thighs. And there's a vaginal delivery method, like the women I mentioned. And then, of course, there's the pellets, which is what I have. And
That's what I have.
Lynette has.
and my husband has those too.
And her husband has those too. And what the pellets are, they're small grains of, about the size of a small grain of rice. And the pellets actually continuously deliver hormones 24/7, depending on what your body needs. It takes it from this slowly released pellet that's inserted just underneath the skin, and the effects can last from 4 to 6 months.
Wow. So is it injected under the skin?
There's a small incision made. It's virtually a numbness, virtually a painless procedure where you come into the office, local anesthetic, it's put in your hip or your buttock area, and it's inserted in the office, and the effect is for months at a time. And I tell my guys, women like them, men, they're like the Bentley of hormones for men. They come in, a Volkswagen, okay, not so bad. You know, the sports car is phenomenal, but the men, their mood changes.
Yeah.
I'm sure your
Oh,
husband,
yeah.
you noticed it.
Oh, everything. And being as old as we are, we're also very active sports-wise, which was beginning to decline as well. And my husband's a big surfer, always has been, and he began to not be able to do that anymore since he's had the pellets. So he's back out there surfing, we bike ride, we ski.
That's great.
I mean, it truly is like a renewal on youth.
Right, and their mood is
Yeah.
so much better. That
Yes.
grumpy old man syndrome is just like,
Yeah.
and you feel the effects within half an hour, within
Wow.
30 minutes of using the pellets,
Yeah.
and then they remain, especially the men, for at least a good solid 6 months of, you get the old guy back.
Okay,
Yeah.
so real quick, what questions would you ask me if I came in? Just real quick, like.
I would say to you, well, besides the typical what brings you in, what's your family history, your medical history, what medications are you on, why are you still on those medications, do you still need them, what
Okay.
vitamins, do you exercise, what's your spiritual health, and then we would get down to more specific issues. So when it applies to hormones, because you have hormones throughout your body, essentially every cell in your body has a receptor for hormone. So it affects everything.
Yeah.
So it could be your hair, your vitality. A lot of women come in for weight. They're very concerned about their weight, bloating, your menstrual cycle. So for someone as young as you, I would focus more on your desire to have children, or if you have them, how many. Have your pap smears always been normal? Are you getting symptoms of PMS, the breast tenderness, the moody, the irritable? Is it something your husband notices in you that's different and you may not notice?
Right.
Are you getting more migraines, joint aches, trouble sleeping a certain period of the month?
Okay.
So most women, when they're experiencing symptoms of PMS, it's for about 2 weeks out of the month. And then as we age and the progesterone levels decline, those symptoms get to be all the time, except when you're bleeding. And then pretty much your quality of life just down the tubes in your mid-30s.
That doesn't sound fun.
No, not fun at all. And then other things your age would be cyst on your ovary. So some women produce too much testosterone, like you had asked me about earlier.
Yes.
And they would have symptoms of thinning of hair right along the crown. Severe acne on their chin, jawline. We've probably seen these women a little bit overweight, kind of round in the middle. And it turns out it's hair in places where it shouldn't be, around the nipples, on the lower abdomen, the inner thigh, and then the hair loss because of the excessive amount of testosterone and the severe acne.
Wow.
The weight comes off, the hair comes back. It totally changes those women's. Then there's something called endometriosis, which would be painful cycles. So it all depends. There's a lot of things, even in younger women, that's related to a hormone imbalance.
Well, I'm excited. I think you've shared a wealth of information for all of us today. And I'm going to set an appointment up.
That would be awesome.
How about that?
We would love to see you.
Yeah, but thank you so much, Dr. Miller, for being with us, and our guests too, and sharing your stories. And I'm so glad that you ladies are feeling amazing and living life again. So
Thank you.
It's been a wonderful opportunity.
yes, thank you. Thank you for being here.
Thank you.
Thank you.
Thank you for being here on Joy in Our Town. I'm Crystal Rome, and we will see you next week. Thanks.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telethon dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.
Pain will not control us. It will never break us, define us, or keep us still. Because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.